So you got some hip pain. So now what do? If you go to the medical doctor, oftentimes, I don't even want to say that. So you got some hip pain. Now what do? You can go the route of getting pain medication to reduce the pain, muscle relaxers, so to relax the muscles in the area, in an attempt to try to hit the symptoms from as many angles as possible. But if you're looking for long-term hip pain relief without any drugs or surgery, then this is the office for you. Now, with hip pain, we have to find out what's going on. A lot of the times, hip pain actually comes from the mechanics and the joints in your feet and ankles being off. It can be from your knees being off, or it can actually be the actual hip joint. So the hip should fit in your hip joint just like this so we can walk around. But sometimes if it should be here and it's moved off to the side or it's not in its correct position, that's going to limit the hip's ability to actually rotate. And with that, like, we have to be able to walk and talk and twist and move throughout life. And if we have different, especially major joints like that don't have the proper range of motion, then that's going to cause some fatigue. The muscles around are going to begin to tighten up and you have some hip pain. And then lastly, we want to make sure that the nerves from the spine that go down into the hips, we want to make sure that those nerves aren't impinged and they're open and free, so we can actually send the proper brain messages down to the hips and back up so that the brain can get the hips to heal fully and completely. So if this is interesting to you, I recommend you reach out to us. We're Invivo Wellness on the east side of Milwaukee, and you can find us at invivowellness.com. Thank you.